Assalamu alaikum wa rahmatullahi wa barakatuh. I am Adra Hazan Ghanem and this is my seminar about the role of hypoxia in the pathogenesis of cell injury, supervised by Dr. Khalid Wissam. My seminar topics are cell injury concept, causes of cell injury, hypoxia, groups of causes of hypoxia, signs and end results of hypoxia. Cell injury, also known as a cell damage, is a variety of changes of stress that the cell suffers due to external as well as internal environmental changes. Cell damage can be reversible or irreversible, depending on the extent of the injury. Causes of cell injury. Number 1, ischemia. Number 2, physical injury, like temperature, trauma, radiation, electrical shock, and other. Number 3, microbial agents, which is mean infection by a virus, bacteria, fungi, parasite, and other. Number 4, immunologic reaction, like in hypersensitivity reaction, autoimmune disease, and other. Number 5, genetic rearrangement. Number 6, nutritional imbalance. Number 7, chemical agent. And number 8, aging. So, oxygen is essential for the body cells to burn food molecules and energy production in electron transport chain. Now, what about hypoxia? Hypoxia is a condition in which the body or a region of the body is deprived of adequate oxygen supply at the tissue level. There are four groups of causes that lead to hypoxia, which include: number 1, ischemic hypoxia; number 2, hypoxemic hypoxia; number 3, anemic hypoxia; and number 4, histological hypoxia. The first group of causes that result in hypoxia is ischemic hypoxia, or we can say stagnant hypoxia, which caused by inadequate blood flow to the tissue that is caused by: number 1, decrease in arterial perfusion; number 2, decrease in venous drainage; and number 3, heart defects. Decreased arterial perfusion. Inadequate perfusion to the tissue refers to decreased arterial blood flow to it. This can be due to the sudden embolic event obstructing arterial flow or a chronic obstructive process leading to decreased arterial flow to the tissue, or thrombosis in the artery, which lead to blockage or narrowing of the artery in addition to cases of atherosclerosis. Decreased venous drainage. It is a state of lack of venous return due to blockage in the vein that leads to disruption in the blood flow process, where as a result, blood congestion occurs in the tissue, so they become unable to receive oxygenated blood, as in the case when a clot occurs in the hepatic vein, as in Budd-Chiari syndrome. Heart defects, like in heart failure, where the heart fails to pump enough blood into the body tissue for several reasons, including disorders of the heart muscle that causes the heart to become weak, in addition to other defects like heart attack, irregular heart rhythms, and other. In addition to other causes of ischemic hypoxia, such as shock that occur due severe allergic reaction, significant blood loss, heart failure, blood infections, dehydration, poisoning, and burns. The second group of causes that result in hypoxia is hypoxemic hypoxia. In order to move the oxygen well from the outside of the body until it reaches the blood, these steps should be successful occur, and these steps are good ventilation, so the air from the outside of the body reaches the alveoli; good diffusion, the oxygen passes well from within the alveoli to the bloodstream, passing through the basement membrane; good perfusion, adequate pulmonary circulating to bring oxygen from the lung to the cells of the body. Oxygen present in the blood in two states: in a free state and in bounded state. In a free state, where it's found freely in the blood plasma, and its percentage in this case is measured by the partial pressure of the oxygen, and its pressure should not be less than 16 mm mercury. And in bounded state, where it's bound in the hemoglobin, and, and measured by oximeter, and its pressure must not be less than 97%. Any defect in the respiratory mechanism and the passage of oxygen will lead to decrease of oxygen in the blood and hypoxia, and these defects include: number 1, ventilation defect, like in pulmonary edema, atelectasis, or any infection in the lung that lead to loss of its function; number 2, diffusion defect, like in pulmonary fibrosis; number 3, perfusion defect, like in pulmonary embolism. Other reasons include hypoventilation, like in cases of diaphragm defects, as in cases of damage or inflammation in the phrenic nerve and the phrenic nerve palsy, as well as the cases of taking of some anesthetic drugs or drugs that assisting in anesthesia in overdose. We can add to these cases of ascending to high places where a person suffers from a state of breathlessness. The third group of causes that result in hypoxia is anemic hypoxia, which includes some of reasons and including number 1, decrease in RBC count. This is lead to decrease in the ability of a blood to transport oxygen. Number 2, carbon monoxide poisoning. This is because of carbon monoxide has a high ability to bond to hemoglobin in the blood, and it causes the skin to become cherry-like appearance. Number 3, methemoglobinemia is a condition of elevated methemoglobin in the blood, and in this case, the skin become blue in color, cyanosis, and it can be happen due to intake of certain drugs, chemicals, include sulfa drug, nitrates, or even food substance. The underlying mechanism involves some of the iron in the hemoglobin being converted from the ferrous form to the ferric form. The fourth group of causes that result in hypoxia is histological hypoxia, as in the cases of cyanide poisoning, where it enters into the blood, causing toxicity and disruption in the action of the cytochrome enzymes, which stimulates oxidative inorganic matter. In this case, the cell will not consume the oxygen even though there is sufficient oxygen amount in the blood. The earliest signs of hypoxia are confusion, restlessness, shortness of breath, and when hypoxia lasts for a longer period of the time, it can cause coma, seizure, and even brain death. Life support is required for respiration. Organs most affected by hypoxia are the brain, the heart, the liver, and if hypoxia is severe, irreversible damage can begin within the 4 minutes of the onset, and tissue death will occur. The reference of my seminar was Robin's Basic Pathology and Pathology Understanding Human Disease by Abner Golden. Now, I reached to the end of my seminar. I wish it was useful for you and thank you for listening.